Hello, I believe we are live. I'm very, very sorry that we've been experiencing some technical difficulties with our streaming program. But perhaps somebody would like to let me know if you are seeing this live on YouTube or Facebook. It looks like we might be. There looks like 13 people are coming through already on YouTube. So that's great. Maybe we are going live. Apologies about this slightly incoherent start. We'll get started and I'm sure everything will sort itself out. So welcome to Speaking Week and today's session, which is focusing on medicine. And as I said, we are hopefully streaming live through both at official OET YouTube and Facebook channels. And hello to everyone. Thank you for patiently waiting for the beginning of the session. And we really love hosting Speaking Week, and we have dedicated live sessions coming up for each of the 12 OET professions this week. So if today's session doesn't match your profession, check out which date is specifically for you on the screen now. Nursing is coming up tomorrow. I know there'll be lots of nurses interested. And then we've got sessions for our allied health professions coming up later on during the week. But do hang around, even if you're not a doctor and you're not, your session isn't coming up just yet. Do hang around today because there's going to be plenty of tips in this session which can easily be applied to your profession. And the other thing to mention is that these sessions will be available as a video. So if you can't stay for the whole of the session, you can come back and watch them once the video is released later. So in this session, we're going to be looking at a brand new OET role card and listen to some actual candidates completing the role play as practice for their test. And I'm also going to get you involved. It's going to be quite an interactive session. I'm going to regularly be asking you for your opinions and to comment as we go along. So please make use of the chat box, as many of you are doing at the moment, to say hello. Whether it's on Facebook or YouTube, those comments come through to us. And my colleague Lauren is also behind the scenes checking for other comments coming through, and she can assist you with any queries if it's not specifically about the session. So let's practice this now. I want you to tell me in the chat how many role plays you complete in your speaking test. This is a really easy question to answer. I'm even going to give you a multiple choice here. The answer is either 1 or 2. So how many role plays do you complete in your OET speaking test? Put that into the chat now, and it'll just let me know that everyone is participating and warmed up. That's great. Yes, I can see some responses coming through. Aisha, Abin Menu, Nisha, Kwan Kamal, all saying 2 role plays. Absolutely correct. You do 2 role plays during your speaking test. It takes around 20 minutes in total to do both of those. So great to see those answers coming through. As I said, I'll be asking you to do more of that as we get going. But let's get into today's session. So on the screen now is the new role card for medicine, and you can download your own version from this link that we're popping into the chat box now, because the card might be a little bit small for you to read on your screen. And all the cards, one for each OET profession, is going to be added to the OET website at the beginning of next week, once we've done all of the Speaking Week sessions. But for now, I'm showing you the candidate card only, which is all you see, of course, when you take your test. The interlocutor card stays hidden to make the conversation more authentic and unscripted. So if you have downloaded the role card to have your own copy, please also only try to look at the candidate card at the moment as well. So the first thing I want you to answer about the role plays is that before both role plays, as we've just established, you get 2 role plays in your speaking test. And before each role card, you have 3 minutes to prepare. And I want you to tell me up to 3 things that you do during this preparation time. There's plenty of things to choose from. So pop 1 or 2 or 3, if you've got those ideas, into the chat. How do you make the most of your preparation time as you're getting ready for your test, or when you're just practicing with a friend or colleague? What are some of the things you think are a really good thing to do in that 3 minutes preparation time? I'm sure there's some good ideas among the audience. So I'll just give you a few more seconds to let me know. Yes, Yahya is saying underline important information. That's a really good idea. Manu is saying, yes, make sure you understand the setting. And Shima, that's a really good point from you. Thank you for sharing that. Ask for any misunderstanding from the interlocutor. So if there's anything you don't understand, check that with the interlocutor in your preparation time. Really good ideas coming through. And whatever you do, it's good to be methodical and to use your time wisely. So let's look through this card as an example of what to do. And first of all, as a couple of you have mentioned, you need to make sure that you look at the setting at the top of the card and make sure that you really understand this information. It's a very small piece of information, but it is significant because it can tell you how serious or routine the situation is, whether the patient is currently at home, visiting you at work, or admitted to hospital. It can even tell you something about the age of your patient. So, for example, if the setting is an aged care home or children's ward, it gives you an idea of how old your patient is going to be. And there's a wide range of settings that could be used in your role play. You won't, of course, need to say anything about the setting in the role play, but paying attention to it is an important tool to helping you start to visualize the conversation you are about to have. In this card, the setting is a medical clinic, and that tells us it's likely to be a routine healthcare conversation, and the patient has come to visit the doctor at the clinic. So, second of all, you're going to focus on the background information. And this will always give you details of the patient's age and their healthcare reason for the conversation, but it will never tell you the patient's gender or name. And there's an important reason for this. All OET tasks are written to be genderless, and your patient will simply be the gender of your interlocutor. The background information will also tell you if you are speaking to the patient themselves or a relative of the patient. And if it's the latter, if you're talking perhaps to the parent of a child, the information will also mention that that child isn't present for the conversation, so that it's always really clear that you know that you're just speaking with the interlocutor. You don't need to pretend that there's anyone else in the room with you. And for this card, the background information tells us that we are speaking to a patient who is 86 years old, and he or she is experiencing discomfort in his or her lower back. And you suspect that to be mild back strain. The card suggests that this is your first meeting with the patient, so you would need to introduce yourself to them. And additional details are also given about the patient's limited mobility. So lots of information to pick out from the background information on the card. And finally, you are given the tasks in a bullet point list. And the purpose of these tasks being given to you is so that you have plenty to speak about during the 5 minutes of the role play. You're not assessed on completing all of the tasks, but the success of the communication for this section of the role play, whether is going to be what's most important. It will tell you whether you are giving or gathering information, whether you are providing advice or reassurance. And the verbs are what you need to know or need to focus on, particularly to understand the function of that communication. You'll also notice that there are brackets provided with each of the tasks, and this information is there to help you, sometimes giving you examples you can use with the patient or directions of how to complete the task. So the tasks on this card that we're looking at on the screen show a balance of gathering information by asking questions and giving straightforward information in terms of the diagnosis, some advice and recommendations, as well as encouraging the patient in compliance with the need for rest, but also the importance of them returning to their exercise later. Remember, with the brackets, there is an expectation that you don't just read out all of those examples as a list, but you expand them into full, complete ideas. So, a couple of other things that I think are always really important that you ask yourself during the preparation time. First of all, this is whether you understand everything on the card. Is there anything, any word that you need defining? Is there any word that you're not really sure how to pronounce? These are things, as somebody mentioned a little bit earlier in the question that I said, what to do in your preparation time. These are things that you can ask the interlocutor during your preparation time. So let me know in the chat, are there any words on this card that you would like defined or that you would like to know how to pronounce? Just while I'm waiting for responses to that, I can see a good couple of questions coming through um, that I will come back to towards the end of the session. So we've starred the sessions from Frank and Ahmed, and I'll answer those questions, sorry, at the end of the session, but great questions I will come back to. So it seems like you probably all agree with me that in this card, the language all seems pretty routine and easy to understand or pronounce. But at the same time, don't just think about whether you understand all of the information. Also consider if there are any words on the card that the patient would be unfamiliar with, given the context of your conversation. So, for example, if you have a role card where the patient is being newly diagnosed with a condition, you would expect them not to be familiar with the medical terminology associated with that condition. And you would need to decide how to introduce those terms or omit them in favor of something that's much more appropriately lay in terms. Is there anything on this card that you think you would avoid saying to the patient? All right, nothing's springing out from people. And I think really the information on this card is fairly straightforward. So it's something definitely to remember. Quancamol is suggesting ligament might be something that the patient isn't so familiar with. I'd certainly say that's on the borderline. Some patients may be familiar, know the word ligament, but may not know exactly where that is in the body or what that refers to. So that would certainly be something that you could consider changing into something a little bit more easy. Finally, the thing to think about is timing. So there are no marks for completing all of the tasks, but you are expected to manage the conversation and move the conversation forward from topic to topic when you feel it has been suitably completed by yourself and the patient. So it can be helpful to assign a rough time in your mind during your preparation time, so that you know which tasks to move through more quickly, which ones you want to spend a little bit longer on. And there could be a number of reasons why you want to spend a little bit longer on any one of the tasks. It could be new information for the patient. the patient might have questions or concerns about that information, or the topic could be quite sensitive. So looking at the tasks on this card, I would suggest that tasks 1, 2, and 3 could be completed fairly quickly. They're fairly standard gathering of information and simply giving of the diagnosis. And that would allow you more time to spend on tasks 4 and 5, which will also evidence a wider range of the assessment criteria because they're a little bit more complex to complete. So having looked at the roll card in a good amount of detail, we're going to move on to listening to some candidates completing this roll card, which we did ahead of Speaking Week, so that we could use the audios to discuss in these sessions what to do and what to avoid in your speaking test. So the first recording we're going to listen to is with Sami, who's a doctor from Finland. And I'm going to ask you to listen to the start of the role play and then answer the question you can see on the screen. Tell me, compared to the roll card, do you think this opening is appropriate or inappropriate? So listen to the recording and then put in the chat box whether you think it's appropriate or inappropriate.
Good morning. My name is Sami. I am one of the doctor here. Please sit down, have a seat.
Thank you, doctor.
How should I address you, please?
You can call me Anna.
Sorry, I didn't hear well.
Anna.
Anna. Okay. Nice to meet you, Anna. How can I help you today, please?
All right, so let me know in the chat, do you think that was an appropriate or inappropriate way to start the conversation? Looks like we might be experiencing a bit of lag. Here are some responses. Lavanya is saying it was inappropriate. Dilip could have asked the name in the preparation time, but otherwise okay. And then we've got a few more people coming through. Appropriate, some are inappropriate. So I would say that actually this is a fairly appropriate way to start the conversation. You can see the script on the screen now. It's polite and friendly, and it was a good idea to clarify the patient's name rather than to pretend to have understood it, because as we saw in the roll card, this is probably the first meeting. So asking the patient for their name during the introduction is appropriate, and making sure to check and clarify that is a good idea. So on the whole, I would say this is an appropriate way for starting the role play card. The only thing I would say as a tip is that it's not necessary or required to do any acting in the speaking test. So the interlocutor will already be sitting down when the recording starts, so you don't need to offer them a seat. The greeting and introduction the doctor used were sufficient for evidence of relationship building. So thinking about task 1 now, which is to find out the reason for the patient's visit, we're going to listen to the doctor doing another part of their role play. And I want you to tell me, once we've listened, what the doctor is trying to do here. And you've got 3 options. You can let me know in the chat, A, B, or C. Is the doctor trying to show empathy? Is the doctor trying to summarize the situation? Or is the doctor trying to clarify a misunderstanding? So listen to the audio and then tell me A, B, or C in the comments.
Yeah, doctor, I got up this morning and I just noticed there was some, kind of discomfort in my back.
Yeah.
I'm just worried. It's might be something wrong with it.
Okay, I'm sorry. I'm sorry to hear that. First, please, I would like to check if I understood well. So this morning you woke up with discomfort in your back, and you are worried about something serious.
Yes.
Am I okay?
Yes, absolutely. I think that's right. Yeah.
Okay.
So let me know A, B, or C in the chat. Was he showing empathy? Was he summarizing the situation? Or was he clarifying a misunderstanding? Great, lots of responses coming through for this one. And we've got a mixed bag. We've got some A's, some B's, some C's. But I'd say there's probably a few more B's than anything else. And let's look at the script, and you'll see that that's right. It is summarizing the situation. So the doctor is picking up what the patient told him about her back discomfort to make sure he's understood the patient's feelings about their health issue. And this is an important tip, I think, because it's a common misunderstanding among a number of candidates that they mistakenly think that summarizing can only occur at the end of the role play to sum up what has been discussed. And in fact, it's possible to summarize at many points during your conversation, such as in this example. It's also a handy way of making sure the patient feels heard before you move on to more questions, giving your diagnosis, or whatever the next task requires you to do. So now let's listen to these two separate extracts of audio. And this time I want you to think about structuring the interview purposefully, which is one part of the assessment criteria, providing structure. And I want you to let me know whether you think the first extract is more successful at providing structure or the second extract is more successful.
Thanks for confirming my understanding. So I think what we are going to do is first, I would like to ask you some questions. Then I would like to examine you. Then we will discuss about the diagnosis. And finally, we are going to discuss how we are going to help you. Does that sound okay?
Yeah, that sounds good, doctor. Thanks.
Okay. Now let's talk about some advices which can help you overcome this problem. So I would like to emphasize that you continue exercises, and but before that, I would like to let you know that you should stop your exercises for 1 week. Do you have any concern about that?
All right, so let me know in the chat, do you think extract 1 was more successful about structuring the interview purposefully, or extract 2? I've already had a couple of 1s coming in. Aranya, Merti, and Majida are all saying 1. That seems to be the common view, and I would agree with you. Let's have a look at the script. So we can see in extract 1 that it is more successful. The doctor is outlining the direction of the conversation, which is certainly one way to help patients feel more relaxed by knowing what to expect. Extract 2, on the other hand, is quite confusing for the patient because the doctor takes an almost immediate U-turn on the advice to continue exercising by saying exercising should be paused for a week. So my tip here is to put yourself in the patient's shoes and think about what will help them to feel comfortable in the conversation. Telling them what to expect, what's coming up in the conversation, can definitely help put them at ease. If you realize something you've just said could be confusing, like in that second extract, wait till the end of what you're saying and then correct yourself. So, for example, at the end of the script that you can see on the screen for extract 2, the doctor might have said something like, what I mean is, what I mean is stop your exercises for 1 week to rest your back, but then it will be good for your overall health to return to your exercises again. So overall, this is a good role play with a lot of strengths, including the ability to summarize and, oops, sorry, I've skipped forward one slide. So sorry, here was the slide I wanted you to see. Overall, this is a good role play with a lot of strengths, including the ability to summarize and signpost. There are still some areas that Sami could work on. So, for example, overusing certain favorite phrases such as let's talk about or how does that sound. Really, repeating a phrase once or twice is okay, but try to show the assessors more range by mixing up your use of language. Despite these small issues, Sami could feel ready for his test and book it when he is ready to do so. So the next doctor we're going to listen to was Bernadette from Italy, and I'm going to play 2 extracts to begin with to focus on how she is asking the patient questions. So I want you to listen to the 2 extracts and let me know your opinions about what is different between the questions in the 2 extracts.
I see. I'm kind of send the key. You can worry, but let's figure out what happened. Where your discomfort is located exactly. Did you have did you did any an extra exercise or fall? Anything can explain this pain, this discomfort?
All right, let me know if you can identify anything particularly different between the questions in those 2 extracts. We'll look at them in the script together. All right. So with these questions, it might have been a little bit difficult for you to pick out just from listening, because both of the extracts, the questions were not really clear, were not as fluent as they could be. But what I want you to notice on the screen is in extract 2, the doctor ends up asking a compound question about the causes of pain, perhaps because she can't think about how to phrase the question that she wants to ask. So she joins some ideas together. And this is something that should be avoided. It's important to only ask the patient one question at a time so they don't feel confused about what to say in their response. And questions are a common problem in the speaking test for all OET professions and worth spending time improving. And towards the end of this session, we're going to spend a bit more time looking at some of those common issues for this role card that the candidates had when asking questions. Listen now to the doctor completing the second part of task 2, which is to explore any possible causes. And let me know how you would rate their response on a scale of 1 to 3. So you would give it a 1 if you thought it was a weak response, 2 if you think it's an okay response, and 3 if you think it's a strong response.
Yeah, so I went to my regular chair exercise class. So I take these chair exercises class that they help me with my walking because I use a frame. But nothing happened during the class really. It was all okay. I just noticed this when I woke up this morning.
Okay, maybe there's some overstretching of your muscle and ligaments, so an orthopedic problem. But I think this is better to start a physical examination to confirm the diagnosis. So I recommend some rest. A week off, maybe 1 week off from exercise classes. So no classes when you are feeling pain, not ignoring your pain. Is that okay for you?
All right, so what would you give that response out of 3? 1 is weak, 2 is okay, 3 is strong. You see most people coming through already are suggesting 2. It's an okay response. And that's exactly what I said as well. So let's look at the script to understand a little bit more about what the doctor was saying. It is okay, but there's certainly more weaknesses than strengths. And there's a missed opportunity to summarize what the patient has just said about their chair exercise class and the onset of their pain. The use of orthopedic problem also wouldn't help the patient know if the doctor therefore considers this a serious or a minor issue. And the response isn't particularly cohesive. What we mean by that is that a number of different points are made in quick succession. Possible diagnosis, need for examination, rest from classes, without any check on the patient's thoughts or understanding until right at the end. So my tip here is to try not to cover too much ground before involving the patient by asking if they have understood, if they have any concerns or thoughts about what you have just said. One more extract from this doctor, this time completing the second part of task 2, which is to make further recommendations, for example, a heat pack or paracetamol. Listen particularly to how the doctor answers the patient's question about what a heat pack is, and then perhaps let me know in the chat what your definition of a heat pack would be if you were going to give one to a patient.
Maybe I can also recommend you some heat pack or some drugs like paracetamol or acetaminophen for the pain, for the lower pain, back pain, to help you in this period, in this week. So
Okay.
to diminish the inflammation of your nerves on your ligaments too.
What's a heat pack?
Right?
What is a heat pack?
A heat pack, it's like a kind of color on your back pain to diminish your pain, your discomfort.
All right, so how would you define a heat pack? Majda and John are both saying a warm compression. That's a good idea, although compression is perhaps also not a particularly clear term if the patient has no real idea about what it is you're describing. Vianne is suggesting a heat pack will help to relax the muscles. Yeah, so those are some good ideas. Let's look at the script of what the patient, the doctor themselves said in this scenario. So perhaps the doctor was unfamiliar with a heat pack. She does certainly manage a definition at the end, but I don't think the patient would have been much clearer for hearing it. Remember that the information given to you in brackets doesn't have to be said exactly as it's written. Particularly when there's an EG within the brackets, these are examples that you can choose to use or not as you wish. And if it's not something you're familiar with, as we discussed at the beginning of the session, it's good to ask for a definition in the preparation time, or to use in the preparation time to decide in your mind what the patient might need explanation about. So mentioning, as some of you have said on here, that it's similar to a hot water bottle or a heated towel. These would have been certainly better options than the way that this doctor explained it. So overall, this doctor provided a slightly weaker response. And Bernadette has some areas that I think she should work on before booking her test. She still had strengths, and these were that she sounded very professional and respectful, and she managed the conversation well. She was able to move it forward from task to task appropriately. Some other things I think that she could think about working on is making her voice sound warm when she is giving empathy, and really listening to what the patient is saying and then responding appropriately to this. We've got another doctor's examples now to listen to. And this doctor, his name's Raut, and he comes from Israel. And again, I'm going to play you the beginning of the conversation. And again, like we did in the first example, I want you to tell me whether you think it's an appropriate or inappropriate way to start the role play.
Yeah. Hello, what's your name?
Hi, I'm Alex.
Alex, hi, I'm Dr. Raut. Why did you come today?
What do you think? Is that an appropriate or inappropriate way to start the role play? Very cleared voice, no problems at all there with understanding the doctor. But in terms of appropriateness, relationship building, was that appropriate or inappropriate? Yes, I agree. It is an inappropriate way of starting the role play. And if we look at the script, I think it's very clear to see what the problems are here. The introductions are made quite abruptly, and the tone isn't particularly friendly. And the real problem is with that question, why did you come here? Which sounds a bit more like an accusation than an invitation to speak about a healthcare issue. So remember that starting the conversation is a really small part of your speaking test, but it can determine how well the rest of the role play goes, as well as how your confidence is. If you start the role play well, your confidence is likely to go up and you'll feel better about carrying on. So consider writing down the starting language you want to use during the preparation time to make sure that you can start politely and in a friendly, professional manner. All right, listen to the same doctor completing the first part of task 2, which is to find out more details about the problem. And then let me know in the chat whether you think the questions the doctor is asking use accurate English. So you can tell me you think that yes, partially, or no. How accurate are the questions?
Okay, so do you feel it from today? Yesterday, everything was fine?
Yeah, everything was fine yesterday, just when I got up this morning.
Okay, so can you locate the pain for me? Tell me exactly where it is.
Yeah, it's just right down the bottom here.
Okay, and it hurts more when you sit or when you walk, when you're doing activity, or when you're still?
It's actually not pain. I think it's just more a discomfort.
Okay, and when do you feel it more?
I guess it's the same feeling all the time.
Okay, you woke up from the pain or with the pain?
I just noticed it when I got out of bed.
Okay. And it's getting worse since then?
No, not really. Just a discomfort, and I'm just worried that I've damaged something. You know, I'm.
All right. So what did you think to those questions? Are they accurate in English? Yes, partially, or no? Got a couple of no's coming through, and Shazada thinks she's also identified compound questions. Some other people are feeling a bit more positive, saying yes, they are accurate. Jitendra has also identified that there was a compound question being used there. So yeah, let's have a look at the script and pick out some of the details. So the first few questions are definitely well phrased and they are clear for the patient to answer. But then, as several of you have identified, there is a compound question about when it hurts more. This would have benefited being left as an open question or splitting into separate questions. So, for example, does it hurt more when you're active? And the last question, it's getting worse since then, is actually an example of what we call a leading question and is also something that you should avoid for your speaking test, because leading questions push the patient towards answering a question in a certain way or gives them an idea that they may not have had independently. So, for example, this patient might think you are questioning whether their pain is serious enough for their visit today. So my tip for questions is listen to the last role play that you recorded. Hopefully that's part of your common practice, that you record yourself whenever you practice doing a role play. And listen to that recording and then focus on the questions that you asked. Are they clear, like the first ones that this doctor was asking, or are you using compound or leading questions? All right, we've got one more extract from this particular doctor. And this time we're going to listen to the doctor responding to the patient's question, which comes while they're completing some of the later tasks, which is to advise against or recommend 1 week off exercise classes, stress importance of rest from exercise, and emphasize the benefits of the exercise classes. And you'll hear the doctor forget some words in the middle of the conversation. And I want to know, in your experience, have you ever had a similar problem in the middle of a conversation? Have you forgotten the word that you need to use? Let me know if it's a yes, a no occasionally, or sorry, a no never, or occasionally. So listen to the doctor and how they deal with forgetting the words.
The stretch muscle is, you can get it worse, okay? You have to, first of all, wait. I forgot the word, but you have to rest a little and make this muscle go back to its usual feeling, and before you stretch it even more, and you can hurt the surrounding of this area.
Mm-hmm.
So I recommend you do wait a few more days until you go back to your regular exercise.
Okay. I mean, I'm 86. I wonder, should I just give up exercise altogether? Maybe it's too dangerous for me now.
I think you should actually I'm forgetting all my words. You should adjust the exercise that you're doing to your age, but it is important for you to actually exercise and walk a little and stretch your muscles. It is important. Don't sit at home.
Okay.
It's not good.
All right, I can see lots of honest responses coming through on the chat, that many of you occasionally experience this problem as well. And I would say it is definitely something that happens to most people and can be much more likely under stress or when you're tired. I'd say it's quite rare if you've never experienced that. But I think what the doctor does here is he manages it very well. So he does it twice, but he recovers the conversation in both times, either by remembering the word he initially wanted or by using an alternative. And my tip here is really some reassurance. Hesitation is part of the score that you receive for fluency. But if it's genuine hesitation like this and isn't throughout the conversation, and you're able to recover and continue the conversation, it won't have a significant impact on your score. So the best thing to do is, like wrote, just to remain calm and to move on, thinking of something else to say, rather than getting panicked and flustered. So overall, Rote was stronger on the linguistic assessment criteria. His speech was definitely clear, easy to understand, was at a good pace, and there was a nice reassuring tone apart from that opening that we listened to. But the clinical communication criteria needed a bit more work before he would be test ready. So some of the structuring and signpost language that we heard in some of the other doctors' examples are missing. Showing empathy, checking information with the patient after giving an explanation of the treatment plan would have made this a stronger response. So we've got one more doctor that we're going to look at in detail, and this one is from Marisha, a doctor in America. I want you to listen to Marisha completing the first part of task 3, which is to give the possible diagnosis of mild back strain. And then let me know, as you've done before, on a scale of 1 to 3, how would you rate the doctor's completion of the task? 1, very good, 2 is good, and 3 is not very good.
I think that you may have a possible mild back strain, which is usually due to overstretching of the muscles or ligaments, but it's not really a cause to be worried about or to be concerned about. I
Okay.
would recommend 1 week of exercise classes where you're not exercising when you're in pain, but do not ignore the pain. I would say that you take a week off from exercise because that way it will allow you to recuperate and heal those
Oh,
muscles or ligaments that you overstretched.
All right, so what did you think to their completion of task 3? Was it very good, which is a 1, 2, which is good, or 3, not very good? We've got a few people saying not very good, and then a few people saying very good. So we've got some splits here. I would actually go for somewhere in the middle. This doctor certainly has excellent fluency and intelligibility. She's really clear to understand and is very flexible with language, so she can sound very reassuring. But what stops this, I think, from being very good is that she has loaded the response with a little bit too much information without checking that the patient is following or is clear about what she is saying. So remember that after you've given any significant piece of information, check with the patient if what you said was clear and if they have any response to what you said before you continue with giving other information, even if that information is related. Think of your communication like a game of tennis. So the ball or the speech that you're making can only be in the air for a short period before it lands, and you need it to be returned by your partner. So if you have that image of a game of tennis, I think that might remind you or make it more visual that you do need to share the speaking time with the patient. Let's listen to the same doctor completing task 5, emphasize the benefits of exercise classes and advise against overdoing exercise. And after we've heard the doctor speaking, I want you to think about if you were the patient, having listened to the doctor there, would you have been persuaded to continue with your class after that explanation? And you can tell me yes, no, or not sure if you're not.
Okay. You know, maybe I'm 86, you know, perhaps it was from the exercise class. Maybe I should just stop going to the exercise class altogether. It might be too dangerous for me.
No, please do not do that. I understand your concerns, but the benefits of going to your exercise class, there are more benefits of going to your exercise class. Not only does it improve your posture, but it also maintains your muscle strength, it boosts your energy along with your mood, and it also improves your social interaction with other people. The only advice I give you is not to overdo exercising. Be aware of your own limits. But do you have any further questions or any concerns?
So if you were the patient, having listened to the doctor just then, would you have been persuaded to continue going to your exercise classes after listening? Yes, no, not sure. We've got a couple of not sures. We've also got a couple of yeses coming through. Yeah, mainly yeses coming through. Yeah, I would agree. I think the doctor managed this very well and used some good structuring language to complete the emphasize part of the task. So not only, but also. And the advice against overdoing exercise is also presented in very natural sounding language. The only thing I would have changed would have been to allow for a short pause between that advice and then checking if the patient had any questions, because that came right on the end and it sounded a little bit rushed. So the tip here is when you're using the examples provided for you on the card, don't just read them out as a list. Do like this doctor did and add supporting language so that they do sound like natural speech. All right, finally, I want you to listen to how the doctor brings the role play to a close, and specifically to listen for her use of the word concerned near the beginning of the conversation. And then let me know if you think this is the best adjective to use, given what we know about the rest of this conversation. So is concerned the best adjective to use here?
I'm really concerned about the discomfort in your lower back. I hope that you take some time off and allow it to recover. And I would also like to perform a physical examination if that is okay with you.
Yeah, that's fine.
What did you think about the use of concerned at the beginning of that little extract? Is that the best adjective to use? We've got some people coming through saying no. Some other people saying yes, it's good. Well, let's have a look at the script. So, given what we know about the rest of the conversation, the doctor's saying that they are really concerned about the back discomfort. Seems a bit out of place. Perhaps something like, I'm sure the discomfort in your lower back will improve if you take some time off and allow it to recover. Might have been more appropriate. There's nothing on the card that suggests this discomfort is anything other than, a stretched muscle, a pulled muscle. The patient hasn't suggested it's anything likely more than that. And we know from the background information, we think it's light muscle strain. So just be careful. My tip here is make sure your language choices are personalized to each role play you complete, because the wrong word can throw the conversation off track. In the same way, avoid set phrases that you might have learned to start or finish the role play in case they are inappropriate for the scenario, as this phrase was here. So overall, Marisha completed the role play very strongly and is definitely ready for her test. It was well paced, it was confident, and it was respectful. But there's always a few areas you can work on. And in this case, it would be summarizing and avoiding compound questions. So we're coming towards the end of the session, but I still have a few key points that I want to discuss more briefly to give you some final tips for things to do and things to avoid. So the first one is empathy. And this is something we talk to OET candidates about a lot, the need to show empathy for the patient's situation and or perhaps their health concerns. So I'm going to play you 2 snippets of candidates doing this part of the role play. And I want you to tell me whether you think the first candidate or the second candidate demonstrates better empathy.
Sure. The pain is in my lower back, just here.
Okay.
I haven't got any pain anywhere else. It's just there. And actually, I wouldn't call it pain. It's more just a little bit, it feels different today and a little bit uncomfortable.
Okay, okay. Yeah, I will look into it. And I would like to ask you about whether you had any recent injuries or you involved in any stressful activities like exercise or running or any other unusual thing happened recently for you. I would like to know about it.
Hi, Alex. Um, I I understand that you have some problem with your back. I'm glad you come to see me. And can you tell a little more why you come to see me?
Yeah, you're right. When I got out of bed this morning, I just felt some slight discomfort in my back, and I'm just worried that I've hurt myself or worried I've done some damage.
All right. Yeah, I know it's a real concern for you because we don't know the, the where it comes from. Can you tell me a little bit more about where you feel the pain, the location of it?
Yes, I think this one's pretty obvious. I'm already getting quite a few candidate 2s coming through in the chat box. And you're absolutely right. If we have a look at the script for these 2 candidates, candidate 2 was much more empathetic, and we can tell this from the words that they used. So, for example, I'm glad you've come to see me. I know it's a real concern for you, as well as their tone of voice. In comparison, the word choices of candidate 1 sound a little bit abrupt and uncaring. And this might not have been that candidate's aim. They may not want it to have sounded like that. But this is why I'm saying this tip again. You must think really carefully, not just about the words that you're using, but also about the tone of your voice. You must make your voice sound the way that you want those words to be heard. So for empathy, your voice needs to sound warm and friendly for the patient to really feel that empathy. The second quick focus is speed of speech. So it can be really easy for healthcare professionals who feel very familiar with the content they are discussing to speak about it quickly. And of course, knowing that you only have 5 minutes to talk puts pressure on candidates, and they sometimes feel that pressure by speaking fast. Remember, there's no impact on your score if you don't complete all of the tasks. It's the communication you are being assessed on. So in this card, the patient is 86. And I want you to listen to these two candidates and then tell me whether you think their speed of speech is appropriate or inappropriate for this patient.
Result, yes, please. As a result of exercise, it might have caused an overstretching of your muscles or the ligaments. Okay, and it's not a problem to be so worried about for now. Okay, what we'll have to do now is maybe I'll examine you, do a physical examination of your back, check for any areas of tenderness, and also to rule out any fractures of the bone. Okay, so I'll do that physical examination. They might as well also carry out an X-ray of your back.
Okay.
What I mean here, that we will concentrate on the type of the exercise to prevent this further injury and this further discomfort already, with some physical recommendation that we will explain for you, which will be at the same time of the exercises, which can help you to release this discomfort, like something like some medication, like the paracetamol, or some other physical therapy modality, like the ice pack or the heat pack, something.
All right, so we're already seeing some of you suggesting that no, some pauses were needed. Jitendra says this was too fast coming through from a few of you. And I agree with you. Both candidates' speech here is really too fast. And as a consequence, they lose intelligibility for the patient, who's likely to end up feeling a bit confused and even perhaps exhausting. It can be quite exhausting to listen to someone speaking at you very fast for a minute or two. So my tip is that you need to moderate your speech for the situation. Slower speed is suitable for older patients, but also if you're giving new information or sensitive information. You could use slightly faster speed if you're asking questions or giving information that the patient will already be quite familiar with. But don't fall into the trap of thinking that you're going to score higher on fluency by speaking faster. It can impact your intelligibility and actually have the opposite impact to the one that you intended. All right, the next quick focus point is on pronunciation. Now, I want to say it's absolutely fine that you speak with an accent, provided that your accent doesn't impede the interlocutor from understanding you. And we've heard a lot of different accents in the examples tonight. They've all been lovely to listen to. Remember, you can also ask the interlocutor to pronounce any words that you're unfamiliar with during the preparation time. So knowing those things, listen to these two candidates and then tell me whether candidate 1 or candidate 2 has clearer pronunciation.
Really important to know rest from exercise well, because it helps to prevent you from further injury, strain. Right now you're having a minor back strain. However, if you exercise in the wrong way, it will make it worsen. It will become more serious conditions. So right now, taking a rest from more exercise just 1 week should be okay. But of course, you can also use other things to help your conditions. For example, you can use some heat pad, you can use some analgesics such as Panadol. But right now you don't really have pain, so it depends on your conditions.
But it is important that this kind of discomforts usually have to do with exercise, and you have to take a little time off your regular exercises, but that doesn't mean that you have to avoid classes forever. Those are good for you, but to prevent further injury, you could stop doing it for a week, maybe use some pain killers like paracetamol, you can always use local heat packs or something like that if that helps. And
all right, we've got about a 50-50 split, it seems, on chat at the moment between candidate 1 and candidate 2. I actually feel that candidate 2 had clearer pronunciation, but what I think some of you may have been picking up on was the hesitancy that candidate 2 had at the beginning. So certainly their fluency wasn't perhaps quite so good as candidate 1, but in terms of their pronunciation is much more regular. Despite also having an accent, the words are more fully and clearly pronounced. Whereas candidate 1 has some problems with missing off of word endings, or missing off plural, or adding, a plural S where one isn't needed, and so forth. So it is important that your pronunciation is clear, and you can use free speech recognition tools, such as the one that we're popping into the chat right now. You can use these tools to check how clearly you are understood, and then can work to fix any weak sounds that are causing particular problems for you. Just 2 more points that I want to cover. This one is on sticking to the roll card. And it can be tempting to use your professional knowledge or experience in the role play. But remember that the cards are designed to replicate real life conversations you have with your patients, but that we're only testing your English. The card contains all the information you need to communicate, so you don't need to add to this. Here, we're going to listen to one candidate completing task 2, and he asks 4 questions, and I want you to let me know which of those 4 questions actually relate to the task that you can see on the screen.
Did you have anything hit your back in this week or maybe the previous week?
No injury.
No injury. Okay. Have you ever been diagnosed with arthritis of any sort?
No, I just have problems with walking, a little bit of difficulty, and I use a walking frame, but other than that, no other problems.
So how long have you been using the walking frame, please?
I would say now it's been about 3 years. Yeah.
All right. What led to the diagnosis of the less mobility?
Well, actually, you mentioned arthritis.
Yes, please.
Yeah. So.
All right, so there were 4 questions asked there, and looking at the task you can see on the screen, which of those questions, 1, 2, 3, 4, could be more than one, but which of those actually related to the task? We've got a couple of candidates coming through saying first question only. Zul is saying irrelevant questions. So let's have a look at the questions that this doctor was asking. So only the first question strictly relates to the task. The other 3 questions are outside the scope of what's on the card. And the main problem with this is that it took 2 of the 5 minutes to ask all of these questions, which would have prevented the candidate from getting on to some of the later tasks, which allow you to demonstrate more range and some of the other assessment criteria. So my tip is that you really do stick to the roll card, especially in find out tasks. You do need to show your ability to ask questions, but also your ability in other areas. So limit yourself to just the questions you need to complete those tasks, and then move on. All right, right, and the final quick focus is on responding to the patient. So successful communication, as I said earlier, is a bit like a game of tennis. There needs to be contributions from both the professional and the patient to allow the game, the conversation to keep going. And each person needs to respond appropriately to the other. So listen to this section of audio from one of the doctors and tell me an adjective. I want you to name an adjective, write an adjective you think the patient would be feeling after listening to the doctor.
Oh, right. So before you felt the discomfort, have you done any exercise or anything that can injure your back?
I didn't have any injury, but I did go to my exercise class yesterday. That's my regular chair exercise class, but I didn't feel anything in that session. It just started when I got out of bed this morning.
Oh yeah, yeah. It's very common as I know. Many people who do some like physical activities like exercise can overstraighten their muscles or ligament, which can cause some concerns. So would you like anything you would like to tell me more about your discomfort? Any?
No, I think that's it. What do you think about it?
Oh yeah, yeah. From my opinion, I would recommend you to do a few things. Firstly, I will arrange some physical examinations later, and because it's very important to check the conditions on your back,
Okay.
whether how much it has affected your like muscles or ligament or anything else.
Okay.
Yeah, and secondly, I would recommend you temporarily not to attend the exercise class, probably for 1 week.
But
Yeah.
I love my exercise class, and I don't feel in pain, so I really don't want to skip a week of my classes.
Yeah, I can understand how much you love it. Yeah, but because if you keep doing that at the moment, it may make your condition worse. So I would suggest, if it's possible, you can hold it for just 1 week, and 1 week later you can come back to attend the class again.
All right, so that was a bit of a longer extract, but how would you feel if you were the patient? We've got relaxed coming through, satisfied, Jitendra suggesting being confused. What do you think? How would this patient feel? Another confused as well coming through. Satisfied though as well. I think that I would go with adjectives like supported or valued. What the doctor is doing really well here is listening to their patient and picking up their feelings during the conversation. So, like in the last bit of audio where he repeats the word love, the patient uses about their exercise classes, it really shows that they are listening and are valuing what the patient is telling them. So my tip is, my final tip for the session is to give your patient your full attention. After they've finished speaking, pick up something that they have said, show some empathy, echo what they've just said, as the doctor does here by using some of their own language, or ask a further question to clarify your understanding and demonstrate you have been listening. So we've now looked at 10 samples of doctors completing the same role card and some strengths and weaknesses across them. But one common weakness that I've picked up a few times has been their ability to ask accurate questions. Of course, a successful healthcare consultation, whether it's for OET or in real life, has a typical structure of starting with open questions and moving into closed questions. And most cards will include at least one task, which will get you to demonstrate questioning. So it is important to work on this. I'm just going to look at a few examples of successful and unsuccessful questions for this particular role play before we come to the end of the session. So first of all, thinking about open questions, let's see if we can match these questions into the two columns, which ones are successful and which ones are unsuccessful. Perhaps let me know which numbers you think are the unsuccessful questions. I'll give you a hand. I'll put these in for you. So we can see that most of them are actually quite successful, but one is unsuccessful because it's actually a closed question. You would answer that question with yes or no. And as we saw, the question 4, it sounds abrupt and a little bit rude. Just one correction would be needed for option 2 to make it accurate as well as successful as an open question. But the others in that successful column could all be used in this role play. And here are some examples of successful closed questions asked by the candidates that you heard tonight. And the main difference here between the compound questions is that they are single questions asked one at a time. It does sometimes mean you have to ask a series of quick questions to avoid compound questions, but it is much more successful for the patient if they're asked to answer one thing at a time. So in information gathering, sorry, I've gone back the wrong way. In information gathering, one of the descriptors is to avoid compound or leading questions. And I have a couple of examples of each here. So you can see the questions on the left, and the first question and the third question are leading questions. These put ideas into the patient's mind that perhaps they weren't thinking of for themselves otherwise. So the third option is a really good example. The doctor's asking whether it goes to their thighs or any other location. And the patient might then start thinking, oh, is it going to go to my thighs? Is it going to get worse? Or maybe, oh, my pain isn't severe enough because it's only in my back. This is an example. These are examples of leading questions. Options 2 and 4 are compound questions because, as I've just said, they ask the patient multiple things, which makes it confusing for them to know where to start with their answer. But we can make these questions work as successful closed questions, and I'm showing these to you on the screen now. So to make that first question work, we could simply ask, when did the pain first start? Second question, can you describe the pain to me? We can make this an open question. The third question, to avoid it being leading, we can just say, is the pain limited to your back? And for the fourth one, does it hurt more when you're active? So rather than asking when you're active or when you're still, just picking one of those options. And questions, accurate questions, are definitely going to be something that we spend more time on, create more content on for you, because as I mentioned, this is a common problem for all OET candidates in all of our OET professions. But we have been going now for quite some time, and I do want to bring the session to an end. I'm going to answer a few of the questions that came through earlier, but while I'm doing that, I'd love to know from you whether you learned anything useful from today's session. So if there was something particularly that you thought, I'm going to try this next time when I do some practice for a roll card, let me know in the chat box what that was. It would be great to hear what you thought particularly useful from today's session. And while you're coming through with those responses, I'm going to, as I say, answer some of those questions that came through earlier. So this one that came through from Frank, should you act like you don't know the background information when starting the conversation? So the background information, as I explained at the start of the session, is there to understand the patient's reason for having the conversation with you, and some sort of contextual information so that you can complete that conversation. You don't need to ask them questions about the background information. You only need to ask questions based on what is given on the card in the task, and details to answer that question in the task won't be part of that background information. This question from Ahmed was, is there much difference between an introduction in a clinic and an emergency setting? I would say there should be a slight difference between those two settings. Certainly, I would make the emergency introduction much briefer. So I might just simply give my name. Hello, my name's Rebecca. I know from that you're here because you've just had a car accident, or I know that you're in a lot of pain at the moment. I'd get straight to the reason that the patient is presenting to me. Whereas in the clinical setting, I might spend a little bit longer on the introductions and ask, first of all, an open question. Fajana is asking, can I ask the examiner's name during the preparation time? Remember, it's the interlocutor, which is completely different to the examiner. The person that you do the speaking test with is not examining you. They're not, they don't have any impact on the score that you do receive. The interlocutor is simply there to help you complete the conversation. And yes, you can certainly ask their name during your preparation time. And just to confirm this question from Nisha as well, you can certainly ask the interlocutor if there's a word that you don't understand, they can define that or pronounce that for you during the preparation time. So great, thank you. I'm pleased to know that you found some useful things. So asking simple questions, avoiding leading questions, leading and compound questions, that seems to be the common thing that people learned about today. So that's really great. And thank you so much for listening and participating in the session. So as I mentioned, the complete roll card will be available on the OET website next week. But if you go back to the beginning of the session, you'll find the link that we posted there earlier if you missed that at the beginning. But also make sure that to look out for the ultimate guide to speaking, which is coming very soon. If you've already enjoyed our ultimate guide to writing, which is already available, you'll know that the speaking guide that we'll be releasing very soon will be packed full of tips and support to help you demonstrate what the assessors are looking for. For now, we're adding a link into the chat, which is for the assessment criteria. These are what the assessors use to assess your speaking. And as always, we strongly recommend, if you haven't done this already, that you bookmark or download or print off your own copy of these, so that when you next do your own practice role play, you can reflect on your strengths and weaknesses against the criteria that the assessors are using. Thank you so much for joining me, and we look forward to seeing you again in another session very soon. Bye for now.